Okay, we're back with part 2 of the Field Preceptor Training Program. So now we'll look at some field internship guidelines. The intern must be under the direct supervision and evaluation of a certified paramedic preceptor. We recommend the preceptor have a minimum of 1 year field experience in pre-hospital emergency medicine. Ideally, the paramedic student will be with one preceptor or as few as possible. This practice increases inter-rater reliability. Shifts worked with another certified paramedic preceptor other than an approved preceptor may count as internship hours, provided over 50% of the total EMS calls are with the primary preceptor. The intern will be evaluated by the preceptor on every patient contact. All patient encounters will be written on a field report form and submitted with the intern's daily evaluation to the preceptor. All field internship requirements must be satisfied within a specified time period. It's important for the paramedic preceptor to understand what's expected of the intern. The intern is expected to take part in any start of shift activities that might be the policy of the agency. Such things could be a status report to the oncoming crew, checking equipment, checking supplies, reporting any mechanical problems, daily station duties, ambulance cleaning, restocking as indicated, any training that typically will take place. Evaluation forms provided by the Harrison County Hospital Ivy Tech Paramedic Consortium will be utilized for all intern evaluations. Daily performance records will be completed prior to the end of the shift or bedtime if on a 24-hour shift. Each call will be critiqued immediately following the run when feasible. The intern is expected to take an active part in discussing strong and weak points of the performance. The intern will be given an opportunity to discuss written evaluations with preceptors prior to submitting them to the field instructor staff. Problems. Problems that should be addressed during evaluation sessions include conflicting statements by paramedics, unclear directions or procedures, personality conflicts. Unresolved problems will be initially discussed with the preceptor and the agency ALS coordinator. Further action should be taken through the program director if problems cannot be resolved. Details on the general guidelines are listed in the preceptor manual. But briefly, schedule changes by the intern are expected to remain at a minimum. Missed shifts must be made up at the assigned internship location prior to course completion. All sick days or tardy calls must be reported by the intern to the program director at Harrison County Hospital as well as to the preceptor agency liaison at the internship location. Should a situation develop in which a preceptor seriously questions an intern's competency to continue, the program director, Mike Hunter, phone number 812-734-3818, should be notified immediately. Suggested reasons for concern are, but not limited to, disregard for direction given by a preceptor or other agency personnel, physical or verbal abuse of a patient, inability to function under stress, incompetence with EMT skills, lack of professionalism, dishonesty in any form, serious interpersonal communication skill deficiencies, and failure to adhere to agency or to Harrison County Hospital EMS program policies and procedures. It's very important for liability reasons and safety of the intern and the crew that if the intern is an employee or volunteer with a participating agency, that the intern remain in the internship role while in the internship. This means that if the agency is a fire department, for example, the intern may not change roles to a firefighter. Or if the agency is an EMS agency, the intern may not work as a paid or volunteer member of the on-duty crew. Interns shall perform paramedic level skills only while doing a regular scheduled internship shift and while being observed by a qualified preceptor. Any paramedic skills performed while not scheduled in internship or while working on duty as an EMT or advanced EMT will result in dismissal from the program and possible loss of EMT certification. This practice is a liability for the paramedic program as well as for the field internship provider. Interns may not be in charge of a multi-casualty incident with more than 3 or more patients requiring transportation, unless there is enough manpower on the scene to free the preceptor to directly supervise the intern in his or her capacity as EMS command, triage, or staging. Uniform standards are very important. The student should have a name tag. The program name tag will be worn at all times when on duty unless prohibited by the internship provider. If prohibited by the internship provider, the student will keep their identification badge on their person at all times. Solid black shoes must be worn. Boots are preferred. No clogs, canvas, or open-toed shoes may be worn. A plain white or light blue uniform shirt or other color as defined by the agency, and blue or black slacks. A plain white or blue turtleneck may be worn under the shirt. Blue Dickie style or utility EMS pants are acceptable. No jeans may be worn. Skirts, shorts, or dresses are not permitted. Hair must be pulled back in such a manner that it does not fall forward onto the shoulders while leaning forward. A ball cap style hat may be worn if the affiliate agency permits. Said caps must conform to agency standards. No bandanas or scarves are permitted. Only wedding rings, watches, class rings, or small gold, silver, or plain-colored post earrings, which do not cover the earlobe, are permitted. Earrings and other piercing jewelry may not dangle from the body. Tongue rings must be inconspicuous, preferably flesh-colored. The intern's safety must be the first consideration when jewelry is chosen. Proper body hygiene is required. Perfumes and colognes should be avoided as they may induce reactive airway spasm in some patients. The conduct of the paramedic intern reflects upon the individual, the affiliated agency, Harrison County Hospital, and the paramedic profession. Therefore, the paramedic intern must conduct him or herself in a professional and mature manner at all times. Paramedic interns will adhere to all policies in this manual and any additional agency policies. Failure to comply with policies may result in disciplinary action and possible dismissal from the program. Interns must demonstrate professionalism at all times. All information regarding a patient shall remain confidential. Interns are encouraged to talk to patients and their families. All questions regarding a patient's medical status should be referred to the preceptor. The interns and patient's safety shall be of prime concern. Avoid conflict. A cooperative and interested attitude is a prerequisite. The intern shall notify the preceptor of any problems or conflict that occurs. Patient confidentiality is taken very seriously. Interns are still held to the confidentiality statement that they signed at the onset of clinical. Breaches of confidentiality will be dealt with immediately and may result in dismissal of the intern from the program. Interns are expected to follow the policies as stated in the manual regarding dress regulations, attendance, and skill performance. Have the field internship intern manual in his possession at all internship shifts. Initiate skills summary sheet for the preceptor to evaluate and initial. Assure paperwork is completed is the intern's responsibility. Missing or incomplete paperwork will delay course completion. Participate actively in the critiques of all runs and accept constructive criticism in a mature manner. The intern should seek out learning opportunities and study to improve on deficiencies as noted by the preceptor, including completion of station drills and demonstrations. They should follow the direction and respect the advice of their preceptor and other agency personnel. They should perform related station duties and fulfill obligations as other personnel. This may include cooking, washing dishes, assisting in general station maintenance, in addition to daily paramedic responsibilities. The intern is responsible for their own meals. If the intern is assigned to a crew who purchases their food in bulk and cooks their meals, and if the intern is invited to eat with them, it is the intern's responsibility to pay for their portion of the meal. The intern may perform any paramedic skill that they have been trained to perform. A large but not inclusive list is included in the preceptor manual. The intern may only perform those skills that are included in the agency's protocols. If the agency is performing skills the intern has not been trained to perform, the intern may not perform those skills. An example of this would be if an agency is inserting chest tubes. Our program does not teach this skill, and therefore an intern would not be allowed to insert a chest tube, although they could assist with the preceptor performing the skill. A large list of preceptor objectives can be found in the preceptor manual. Please take time to look at these. As mentioned in the previous slide, a complete list of preceptor responsibilities can be found in the preceptor manual. However, some of the more important ones include giving the intern a proper orientation, ensure adequate experiences for the intern, ensure time to discuss strengths and weaknesses, and performing daily evaluations of the intern. The role of the paramedic intern during the field internship is of an active participant in all phases of EMS operations. It is recommended the intern observe for the first several calls, not shifts, to see how the preceptor handles the calls and performs paramedic duties. The intern must be able to fulfill the role of a certified paramedic at the completion of the internship as a competent entry-level paramedic. It is the preceptor's responsibility to provide adequate experience to fulfill these expectations. On-shift training is an effective adjunct to the field experience and can be used to strengthen an intern's identified weaknesses or test an intern on an area which has not been experienced due to a lack of that type of call. The intern is also expected to take part in any shift meetings or training that are required of the preceptor. The sessions are especially helpful as preparation for the certification exams following course completion. Simulations can be a very useful teaching tool. Preceptors can use them to help an intern become more organized and complete in performing patient assessments. They can also be used to help the intern become more comfortable with equipment so that actual calls flow more smoothly. Unlike actual calls, simulations provide an added advantage because a situation can be redone if the intern's performance is not satisfactory. They also give preceptors an opportunity to expose the intern to patient situations that have not occurred on actual calls during the internship. Reviewing a call increases the understanding of communication problems. By reviewing the run, actions taken or not taken, and run report, the preceptor and intern have a better understanding of the strengths and weaknesses. If an intern has a weakness in one specific area, give a short class or review the topic with the intern, and then quiz him on it the following shift. Performance of the intern during field internship will be closely observed and evaluated by the preceptor to determine whether the intern can demonstrate in the field setting appropriate application of knowledge and skills acquired during the didactic and clinical portions of training. This is a competency-based evaluation. Therefore, all ratings must be based on the field performance standards. A competency-based evaluation is one in which the intern is evaluated in relation to predetermined skill performance criteria. Each call should be discussed and critiqued as soon as possible following the run. Areas of strength and weaknesses are to be discussed with the intern during the critique sessions. Each call is to be recorded by the intern on the daily performance record. A brief but complete description of activities performed by the intern should be listed in the appropriate column. Explanations and comments are to be made by the preceptor in the comment area provided. If an area of weakness is noted, the preceptor, in conjunction with the intern, will develop a plan for improvement. This may include additional station drills, study assignments, simulations of runs, or clinical experience. Examples of these would be evaluation and control of a scene, patient assessment skills, communication skills, attitude, teamwork, treatment skills, use of equipment, judgment, decision-making, establishment of priorities. During the course of field internship, a representative from the Harrison County Hospital Ivy Tech Paramedic Program may visit the internship agency to observe the intern on calls. These visits will be arranged in advance according to the agency procedure. This is the end of Part 2. Please proceed to Part 3.